Sofia was our dream come true. She was our first child. She was very special to us. And when we had that first transplant on Christmas Day and the second transplant on New Year's Eve, we knew that going forward she was always going to be a special child to everyone. We've had Assurant for probably over 5 years, I believe. So, Anna and I had just gotten married, I believe, and I went to my insurance agent and decided to go ahead and take out life insurance, take out health insurance. I'm a small business owner. I don't have the luxury of being able to get a group policy, so I had my insurance agent really try to find me the most economical way to have good coverage, and we still wanted to have very good coverage. So he came back to me with Assurant, with a high deductible plan, tied with a health savings account, and it seemed to make the most sense for us from a business standpoint. Some of the things that I looked at it as a catastrophe policy, that if we had a catastrophe, if I had a heart attack, or if something drastic happened, that we would have coverage. I definitely wanted a high lifetime maximum benefit, and I tell you, these are decisions that I'm really quite grateful that I made because we had our catastrophe. Sofia was our first child, and she was born on August 13th, 2007. We knew pretty quick that there was something wrong with her liver, and we found out about 2 weeks later that she had a condition called biliary atresia. She went through 2 operations to try to correct the problem, which they're more of the type of, it's called a Kasai procedure, and it's done to try to maximize the time the liver can function without having to be transplanted. The first thing that you're worried about when you face something like this is, of course, the medical side of it. What the medical risks. But I mean, being the provider of the family, you also have to think about, how are we going to pay for this? Are we going to be able to pay for this? Are they going to deny us care because we can't pay for this? And having an insurance company like Assurant, who was there for us, who never made us doubt that. We knew that we had great insurance, that that we weren't going to be denied for it, that you guys were there, that we had coverage. So,
and a relationship with the people too, because we'd already spoken. Sean had already spoken to the case manager for Assurant, and we didn't have to think, about coverage or anything. So
Assurant's always been there.
Yeah.
Assurant's never ever given us a problem.
No, never had a doubt.
Never had a doubt.
Sofia was doing really well. We were here at home playing. It was just a normal day. Sofia was about 8 months old then, and at maybe 10 or 11 o'clock in the morning, I noticed that her bowel movement was really dark, and while I was changing her, she spit up what looked like coffee grounds. And so I immediately called her gastroenterologist, and she told me to get her ready as soon as possible and get her to the hospital, get her to the emergency room.
The problem was that her liver had just gotten so cirrhotic that the blood couldn't flow through. The doctors there felt that it was time. The doctors at the University of Miami felt it was time. They said, let's list her. And the last thing one of the nurses told us when we were leaving the hospital was, guys, be prepared for the holiday, because more than likely or not, you're going to get the call on Christmas. And we got started, had a great Christmas morning, got through all the presents, and then we were just getting ready to start cooking Christmas meal about 1 p.m. and the phone rang. It was a 305 area code. I
was shaking, and I couldn't concentrate. I couldn't get focused enough to get her ready. It took me probably a little over an hour to get her ready and out the door, because I couldn't focus. So,
but at 1 o'clock we got the call saying that they had a liver they think was going to work for Sofia, and to stand by the phone that they'll call, let us know probably by 5 with instructions. We got the call back about 5 though that it was a definite go, that they were comfortable it was a match, that the team was already on the way to harvest the organ. Probably about the 4th or 5th day after the transplant, the main hepatic artery started clotting. They started losing signal on it, and and we knew that we had an issue. So it's probably about 12 hours, that surgery, and we got a call from Dr. Cato saying, please come on down to the operating room. We want to talk to you guys personally. And again, you're scared. We came in there, and he said that basically he was still not happy with the blood flow to the liver. He was relisting her status 1A, which is the highest status you could be listed, meaning that she would get the next liver available. And that night, I believe, we got a call and saying that they think that they have another liver already, and that the next day that she was probably going to be transplanted.
And she was retransplanted New Year's Eve.
Yeah.
So
the liver came in, and they went in, they did the surgery, she came out, and I tell you, we've had a very, very good course ever since. We were out of the hospital a week after that transplant.
It was another, the second transplant was another whole liver, so we know it was another small child.
So we knew that somewhere a parent was going through Christmas losing a child, which is tough for us, and it still is tough for us. But it's something that that you have to have. That Sofia needed to live, and that gift. I mean, that family who made that selfless decision to donate at that time, so that some other children could live. We were celebrating for ourselves, but also mourning for the loss someone else had. To receive that gift, especially on Christmas, it's the best gift we'll ever have been given. So
I cherish her. Cherish every smile and every new word and every time we take her to the playground or all the new things she's learning.
And now, she's a little over 2 years old. She's happy. She's rambunctious. She's a wild 2-year-old,
crazy 2-year-old,
which I guess you could define as being normal. And we thank everyone every day for it.